Hello, I'm Dr. Michael Hemphill with Savannah Neurology Specialists, and with me is Sophie Clark, who's the program coordinator for our memory clinic at Savannah Neurology Specialists. We're a member of the Georgia MemoryNet, and we're going to answer some questions that we have found are very frequent questions that patients ask when considering treatment for Alzheimer's disease.
So tell me, Dr. Hemphill, what is Alzheimer's disease and what causes it?
Alzheimer's disease is the most common cause of age-related decline in memory and other cognitive function. The general term we use for this is dementia. Dementia is a term that applies to loss of cognitive function that causes disability. Milder cognitive function we call mild cognitive impairment, but both can be due to Alzheimer's disease. Alzheimer's disease, we believe now, is caused by the buildup of a protein in the brain called amyloid that's not cleared adequately. And for whatever reason, the amyloid interferes with nerve function that leads to these cognitive impairments that causes the decline with age.
And what treatment options are currently available for Alzheimer's disease?
Currently, we have new treatments for disease. For the first time, we now have treatments which can alter the course of Alzheimer's disease. Before, we only had medications that might treat some of the symptoms, but didn't really alter the course of the disease. So at this time, we are trying to find individuals who might be in the early stages of Alzheimer's disease, because that's when the treatment needs to be administered. If one is very far into the disease and has moderate or severe dementia, then they don't respond to treatment and we can't use it. But if someone has mild cognitive impairment or mild dementia due to Alzheimer's disease, then they certainly may be a candidate.
So how do you determine who is a good candidate for these newer treatments?
Well, the first thing we do is to establish that there is, in fact, cognitive impairment. And as I mentioned, we're looking for people who have mild cognitive impairment or mild dementia due to Alzheimer's disease and not more moderate or severe dementia. So our first task is to really establish that cognitive impairment and its severity. The second thing is that we need to make a diagnosis of Alzheimer's disease based on whether or not we can conclude that there's this amyloid buildup in the brain. And the way we do that is through two tests. One is called a PET scan. It's much like a CAT scan, but it's specific for picking up amyloid in the brain. The other test is done on spinal fluid. That needs to be done with a lumbar puncture. We do that by sending people to a radiology office where the lumbar puncture is done under X-ray guidance. We do have blood tests that we may do to screen to let us know whether or not patients should get one of these tests. But right now, the blood test alone is not sufficient to make the diagnosis.
Okay. And what are the possible side effects of these treatments?
The side effects are generally two. One is some flu-like symptoms that can occur with the infusions, primarily the first or second infusion. These are almost always mild, rarely more serious. We do give some medication such as Tylenol and antihistamine prior to the infusions in order to mitigate these symptoms and keep them to a minimum.
Okay.
The other thing that may occur is a later a symptom that we call ARIA. ARIA stands for amyloid-related imaging abnormality. It occurs because with the treatment with Leqembi, there may be amyloid pulled out of blood vessels, which basically leaves small defects in the vessel wall that allow serum to leak out. When it does, there may be some local swelling or inflammation in that area that can be picked up on the MRI scan. When red blood cells get out with this serum, we may actually see some dots of blood or hemoglobin. Those are called microhemorrhages. If we see too much or too many of these, when we do the MRI scans, which we will do periodically, especially during the first few months of treatment, then that may lead us to pause or even stop treatment. So we monitor very closely for ARIA. Approximately 20% patients who get Leqembi might have ARIA, but only about 3% actually develop any symptoms, and these are usually mild, such as some headache or blurring of vision, and less than 1%, approximately 0.7% in the pivotal trial actually develop more serious symptoms. So we know what to look for. We do monitor this very carefully, and serious symptoms are very rare.
Okay. And how many patients do you currently have on treatment?
We currently have approximately 90 patients on treatment here at Savannah Neurology.
Okay. And what can a patient expect after the 18 months of infusions?
We are still trying to decide what to do after 18 months, and by we I mean the scientific community at large. The FDA guidance is just for the first 18 months. It will remain to be determined probably in 2025 as to whether we continue with treatment after the 18 months and how frequently. So those determinants should be made just within the next few months.
Okay, thank you.
Hi y'all, my name's Cambry. I'm one of the infusion nurses here at Savannah Neurology. This is our infusion center. So when you get here, we'll have you come in, we'll take your weight down in this room right here. We'll have you come back, sit down, get comfortable. We'll grab some of your vital signs, make sure that everything looks good. We'll get your IV started. And if it's your first time here, you'll be here about 2 hours. Don't worry if you're hungry, we got snacks. If you're thirsty, we have all types of drinks in this lovely fridge right here. But other than that, we got you covered. We got a blanket, and there's 2 other nurses here that if you have any questions, we're here for you.